Welcome back to the deep dive. Today we're doing something that feels a little bit like hacking.
Hacking, how so?
Yeah. I mean, usually we take a news story or, a big concept and we peel the layers back. But today we are literally handing you the keys to a secret language.
It really is a secret language.
Yep.
But the funny thing is, it's a language hidden in plain sight.
Oh, completely.
It's on your pill bottles. It's on those terrifying bills you get from the hospital. It's in the dialogue of every medical drama you've ever binged. We are talking about medical terminology.
Which, let's be honest, usually sounds like Klingon.
It absolutely does. It's
Yeah.
designed to sound intimidating.
You see a word like gastroenteritis or hypercholesterolemia and your brain just shuts off. It feels designed to keep us out.
Right.
Like, why can't doctors just say tummy ache or high fat blood? Why the gatekeeping?
It feels like gatekeeping, I get that. But there is actually a logic to the madness.
Right.
Historically, this is all Latin and Greek.
Yeah.
But here's the secret that changes everything. Medical terms aren't just random, long, scary words. They are Lego bricks.
Okay, let's unpack that. Because when I see a 14-syllable word, I don't see Legos. I see a headache.
Stick with me. It's modular engineering. I mean it. You have standardized blocks. You have a block that means stomach, a block that means inflammation, a block that means fast, a block that means heart.
Right.
Doctors just click them together to build a sentence that, well, it looks like a single word.
So if you know the blocks, you don't actually have to memorize the dictionary.
Precisely.
Yeah.
You don't. If you know the code, you can decode words you have never seen before in your life. You can look at a diagnosis and say, oh, I know exactly what that is and where it is, just by breaking the bricks apart.
That is our mission today. We have a stack of documents here, our source material, that lists out the most essential bricks in medicine. We have the prefixes. Those are the blocks that go at the front. And the suffixes, the blocks that go at the back.
And we have a challenge, a bit of a mandate, actually.
Mm.
The listener wants us to cover every single term on this list.
Which is a marathon, not a sprint.
It is. But we're going to do it. We are going to verify and sort through every single one. But we aren't just going to read a list, because that would be
the most boring show in history.
the most boring show in history. We are going to give you the hooks, the mnemonics, and the stories to make these things stick.
I want to walk away from this hour being able to read my own medical chart without panic. That's my goal.
A worthy goal and a doable one.
So let's set the scene. If we look at these terms as storytelling elements, every medical term tells a mini story.
It does. It really does. It tells you, where is the problem? How big is it? Is it fast or slow? And finally, what are we going to do about it?
So let's start with the where. Segment 1, the navigator. These are the prefixes of direction and position. Because before you tell me what is wrong, you have to tell me where to look.
Right. And in the body, location is everything.
Yeah.
And a lot of location is actually about time.
The timeline. Okay. We have a cluster of prefixes here that all basically mean before or forward. We've got ante, pre, and pro. They seem interchangeable.
They are very similar, you're right. But they have different flavors. Let's start with ante. That's A-N-T-E. This means before or forward.
The way I remember this one is from poker. You ante up, you put your chips in before the hand is dealt.
That is the perfect hook. That's exactly it. In medicine, you hear antepartum.
Partum must mean birth.
Yep. So antepartum is the period before the birth, or, anatomically, your antecubital fossa is the space in front of your elbow, the little ditch where they draw blood.
Okay, got it. Then we have pre. This feels like the most common one in English.
It is. It's the one we all know. A preview. You view it before. Prenatal.
Before birth.
Preoperative.
Before the operation.
Exactly. Pre is just the standard before flag.
And pro, how is that different?
Pro can mean before, but it usually implies movement, forward.
Like being proactive.
Yes. You are acting forward. Or prognosis. Gnosis means knowledge. So a prognosis is knowing before. It's predicting the outcome by looking forward.
Oh, that makes sense.
Or think of a prolapse.
Ooh.
Yeah. An organ falling forward or down. So ante, pre, pro, that's your before and forward kit. But now we have to look backward.
Right. The other side of the coin, we have post, retro, and re.
Post is the direct opposite of pre, post-game, postscript. Super straightforward.
Postpartum.
After birth, exactly. Posterior, that just means the backside of the body. It's what comes after.
Then there's retro. I always think of retro fashion. You're looking back at the past.
That works perfectly.
Yeah.
Retro means behind or backward. So if you have retrograde amnesia,
You forget things from the past.
right, you forget things that happened backwards in time from the injury, or anatomically, the retroperitoneal space.
That sounds alien.
It does, but it just means behind the peritoneum. The peritoneum is this big sac that holds most of your guts. Your kidneys are actually retroperitoneal. They sit behind that sac against your back wall.
And just our
Re implies back, or again,
Yeah.
to return, to redo.
like reflux.
Exactly. Flux means flow. Reflux is flowing back. Acid flows back up the esophagus. Or rehabilitation, you're bringing ability back.
Okay, so we have the timeline, forward and backward. Now let's play the inside-outside game. This is where it gets a little tricky because we have a few terms that sound similar.
They do?
Let's start with within. We have endo and intra.
This is a classic mix-up. They both mean within, but they serve different grammatical masters, you could say.
Okay.
Endo is usually describing a process or a structure's nature. Think endoscopy.
That's the camera going in.
Yes, looking within. Or endocrine. These are glands that secrete within the body directly into the blood, unlike exocrine glands like sweat that secrete outside.
So intra is the other one. How's that used?
Intra is almost always a GPS coordinate. It tells you inside this specific container,
Intravenous.
inside the vein, intramuscular.
Inside the muscle. Okay, that's a really clear distinction. So endo is inner and intra is inside of.
That's a good way to parse it.
Yeah.
Now let's go outside. We have a trio here, EC, X, and extra.
East and X, they sound like the start of the word exit.
And that is the mnemonic I want you to use, exit.
Yeah.
XE means out. X means out. They're basically the same prefix.
So if I have an excision.
You are cutting something out. It is exiting the body.
Okay.
If you have an ectopic pregnancy, top means place. Ectopic means out of place. The embryo has implanted outside of where it should be.
And extra, that sounds like extra cheese.
Well, don't think of cheese. Think of the X-Files. Extraterrestrial.
Aliens from outside the earth.
Exactly. So in medicine, extracorporeal means outside the body. Like when they put a patient on a bypass machine for heart surgery, the blood goes extracorporeal outside the body to get oxygenated, then comes back in.
Okay, moving on to relationships. This is about where things are standing relative to each other. We have two that people always mix up, and I feel like they differ by only one letter because doctors want us to fail. Ab and ad.
AB versus AD. This is the bane of every first-year medical student, I promise you.
I have a trick for this, and it involves aliens again.
Let's hear it.
Ab. AB. Think of abduct. If aliens abduct a cow, what are they doing?
They are taking it away.
Exactly. Ab means away from. So if you abduct your arm,
You're lifting it away from your body, moving it out to the side.
which means ad must be the opposite.
Correct. Ad means toward or near. Think of advance. You advance toward the enemy.
Or just plain ad, you are adding the limb back to the body.
That works too. So abduct is take away. Adduct is add to. If you see AD, think toward. If you see AB, think away.
Next pair. Peri versus para.
Another good contrast. Peri means surrounding.
Like a perimeter, the fence surrounding the property.
Perfect. The pericardium is the tough sac that surrounds the heart. It wraps all the way around it. The periosteum surrounds the bone.
Okay, so a complete wraparound. And para.
Para means beside or near. It doesn't wrap around, it just stands next to.
My mnemonic for this is paramedics.
Go on.
Paramedics work beside the doctors. They work alongside them.
That's good. I like that. Or parallel lines. They run beside each other. Anatomically, your paranasal sinuses are just the pockets of air beside your nose.
Okay, let's run through the rest of the location markers.
Like the interstate highway goes between states. Intercostal muscles are the meat between your ribs. Below or under. Submarine. Subcutaneous under the skin. Sublingual under the tongue. Very common. Above or upon. The epicenter is the point upon the earthquake. The epidermis is the layer upon the dermis. It's the top layer of skin.
Dia. D-I-A.
This one's a little more abstract. It means complete or through.
Like a diameter. Goes right through a circle.
Yes. The diameter goes through the circle. In medicine, dialysis is the process of cleaning blood through a membrane. Diagnosis is knowing through examination. You're getting complete knowledge.
And diarrhea.
I knew we'd get there.
Had to.
Diarrhea literally means to flow through. It implies a passing through the system too quickly.
Transmit.
Across or transatlantic. A transdermal patch. It sends medicine across the skin barrier. A transplant, moving an organ across from one body to another.
And lastly, ultra.
Beyond. Ultrasound is sound beyond the range of human hearing. Ultraviolet is light beyond the violet end of the spectrum.
Okay, that is our map. We know how to say before, after, in, out, next to under, over, and through,
Mhm.
we have successfully navigated the geography of the body.
And that's the foundation. It really is. If you see sub, you immediately look down. If you see retro, you look back. It orients you instantly.
So now that we know where we are, we need to know what's happening. Is there one of them? Two of them? Are they fast? Are they slow? Welcome to segment 2. This covers prefixes of number, quality, and speed.
And numbers are surprisingly critical because anatomy is all about counting parts.
Let's knock out the easy ones first, but I want to make sure we cover every brick. Unit.
Unilateral, affecting one side of the body. Simple as that.
Right.
Two or both. Bilateral, affecting both sides. Or the biceps muscle. It has two heads, 2 points of origin.
Try.
3, the tricuspid valve in the heart. It has 3 little flaps. Triceps, the muscle on the back of your arm, has 3 heads.
Quadri.
4, quadriplegia, paralysis of all 4 limbs.
Okay, now the ones that are slightly more. Greek. Hemi. H-E-M-I.
Half.
I think of the earth, the hemisphere.
Exactly, half the sphere.
Hmm.
In medicine, this is usually about the brain or the body's sides. Hemiplegia is paralysis of half the body, like the left side or right side.
Which usually comes from a stroke.
Right, and since the brain is cross-wired, a stroke in the left hemisphere of the brain often causes hemiplegia on the right side of the body.
Oh, okay. And polygon?
Many or much.
Like a polygon, many sides.
Or polygamy, many spouses. In medicine, polyuria means urinating many times or too much volume. Polycystic means many cysts. It's a multiplier.
Okay, checking the speedometer. We have 2 words here that you hear on Grey's Anatomy every 5 minutes. Tachi and Brady.
Yes. These are the speed settings for the body. Tachi means fast.
How do we lock that in? It's kind of a weird word.
Think of a car. What is the dial next to the speedometer?
The tachometer.
And what does the tachometer measure?
How fast the engine is spinning, the RPMs.
Boom. Tachi fast. So tachycardia is a fast heart condition, usually a resting rate over 100 beats per minute. The engine is racing. Kachipney is fast breathing.
And Brady. B-R-A-D-Y.
Brady means slow.
The mnemonic here. Look, I don't know why, but I always think of the Brady Bunch.
The TV show. Okay.
Yeah. I just imagine 6 kids, 2 parents, a maid. It must have taken them forever to get out of the house. It was a slow process.
Hey, whatever works. I've never heard that one. But if the Brady Bunch makes you think slow, use it. Bradycardia is a slow heart rate, under
Okay.
60 beats per minute.
So Tacky is the race car. Brady is the overloaded station wagon.
Perfect. Absolutely perfect.
Now let's talk about levels. This is the Goldilocks zone. We have too much and too little. Hyper and hypo.
These are arguably the 2 most common prefixes in the entire hospital.
Yeah.
And mixing them up is dangerous.
Hyper means excessive, more than normal, too much.
Right. Think of a hyperactive kid. High energy, bouncing off the walls. Hypertension is high blood pressure. Hyperglycemia is high blood sugar. Everything is ramped up.
And hypo is the basement.
Below. Less than normal. Under.
Hypothermia.
Exactly. Your temperature is under where it should be. A hypodermic needle goes under the dermis skin layer.
The trick for the listener here, hyper has the E, which you can link to excessive. Hypo has the O, which sounds like.
Low.
Hypo is low, hyper is high.
Simple as that. Don't overthink it.
Perfect. Now let's look at the quality or state of things. Is it good? Is it bad? Is it new? Let's start with dys, D-Y-S.
This means bad, painful, difficult, or abnormal. It's a struggle prefix. Something is wrong.
Dysfunctional. That's easy.
Yes. Dyslexia, difficulty with words. Dyspnea, difficulty breathing. Dysmenorrhea, painful menstruation.
Yeah.
If you see dys, something is grinding gears. It's not working right.
Compare that to mal.
Mal also means bad, but it's less about difficulty and more about poor quality or even evil.
Like a malfunction.
Or Maleficent, the Disney villain.
Mm-hmm.
Mal is bad. Malnutrition is bad nutrition. Malpractice is bad practice. Malformation is something that's formed badly.
Okay, got it. We also have autopilot. It flies itself.
Autoimmune. Your immune system attacks itself. Autograft. When a surgeon takes skin from your own thigh to patch your own arm. A graft from the self. Neonatal.
Newborn or neoplasm.
Plasm means formation. So neoplasm is a new formation, which sounds innocent.
But it's not.
But in medicine, a new formation of tissue is usually a tumor.
That took a dark turn.
It often does in this field.
So some S-Y-N.
Yeah, or together.
Synchronized swimming.
Exactly. Moving together. In medicine, a syndrome is a group of symptoms that run together. They travel as a pack. Synthesis is putting things together.
And finally, for this section, the destroyers. The negators. A and N.
These are simple but powerful. They mean no or not. They are the off switch.
Atom.
Historically, yes. Tom means cut. Atom meant uncuttable. Obviously, physics proved that wrong later, but the name stuck.
And a medical one? Apnea.
Pnea is breathing. Apnea is no breathing, like in sleep apnea.
Anemia.
Emia is a blood condition. And emia is literally no blood, or technically a lack of red blood cells. Then there's anesthesia. Aesthesia is feeling. Anesthesia is no feeling.
It's the ultimate negation. Okay, we've navigated the body, we've counted the parts, now we have to deliver the bad news. We're moving to segment 3, the diagnosis.
This is where we get into the suffixes, the blocks at the end of the word. And
Yeah.
honestly, this is the pain and suffering segment.
Let's start with the literal pain. We have 2 main ones that come up all the time, pheinitis and analgia.
Itis is the superstar. It means inflammation. If you learn one suffix today, it's this one.
Tonsillitis, appendicitis, arthritis.
Yes, exactly. But I want to make a distinction here. People often think infection. But rhinitis doesn't mean infection. It means inflammation, the body's response, the redness, swelling, heat, and pain.
So you can have halitis without bacteria.
Absolutely. If you eat a bucket of jalapenos, you might get gastritis, inflammation of the stomach, no bacteria, just spicy regret. Dilatanus is the body's fire alarm going off. The cause could be anything.
Got it. Then we have algia.
That simply means pain,
My mnemonic for this is nostalgia.
which is pain from the past.
Yeah, that bittersweet ache, you know. Algia is pain.
That works. Fibromyalgia, pain in the fibers and muscles. Neuralgia, nerve pain. Arthralgia, joint pain.
Oh, wait. What's the difference between arthritis and arthralgia?
Great question. Arthritis is the inflammation. The joint is hot, swollen, red. Arthralgia is just the sensation of pain in the joint. Without those other signs, you can have one without the other.
Okay, let's talk fluids. We've got blood, thirst, and urine. First, emia.
Blood conditioning.
Anemia we covered. Leukemia.
Leuc means white. Emia means blood. Leukemia is a condition of the white blood cells. Or hyperglycemia, high sugar blood condition.
Nitzia.
I always think, I'd like a dip of water. It's silly, but it works.
It's not silly if it works. Polydipsia. Many thirsts. It's a classic symptom of diabetes. You're excessively thirsty.
And urea.
Condition of urine. Hematuria, blood in the urine. Polyuria, frequent urination. Anuria, no urine production at all, which is a medical emergency.
Now, we have to talk about the flows, and this is a danger zone because the spellings are terrifying. We have urea and rages.
Double R-H-E-A and double R-H-A-G-E. Yeah, they're rough.
Let's start with rhea,
It means flow or discharge.
and the example everyone knows.
Diarrhea, dia through plus rhea, flow, flowing
Yeah.
through. But there's also rhinorrhea.
Rhino means nose, like a rhinoceros.
So rhinorrhea is.
A runny nose, nose flow. Exactly. It sounds so fancy, but it just means you need a tissue.
Then we have Raj or Raji. This one feels more aggressive.
It is. It implies a bursting forth, usually an excessive discharge of blood.
Hemorrhage.
Right. Hemo, blood plus bursting. The end of the word sounds like rage. Hemorrhage is a violent flow of blood. Menorrhagia is excessive menstrual flow.
Got it. So Rida is a flow, Raj is a burst. Now let's talk about structural problems. Things getting big, hard, or narrow. First up, megaly.
Enlargement.
Mega-sized, easy.
Cardiomegaly, enlarged heart. Hepatomegaly, enlarged liver. If the doctor says you have organ megaly, that organ is bigger than it should be.
Sclerosis.
Hardening.
Arteriosclerosis.
Hardening of the arteries. The walls get stiff and brittle. Multiple sclerosis. It involves hardening of tissue or plaques in the nervous system.
Stenosis. I use stenographer for this.
How so?
A stenographer types on that tiny little machine. It's very narrow. Or maybe sten just sounds thin and tight to me.
Visuals work. Spinal stenosis is a narrowing of the spinal canal. It squeezes the nerves. Arterial stenosis is a narrowing of an artery, blocking flow. It's like a pipe getting clogged.
Spasm.
Constriction or involuntary muscle contraction.
Like a back spasm. Everyone's had one of those.
Exactly. But imagine it happening in your lungs.
Mm.
Bronchospasm. The airways twitch and clamp shut. That's a key part of an asthma attack.
Oma.
Tumor or mass.
Melanoma, carcinoma, lymphoma.
Right. If it ends in oma, it's usually a growth. Now, it's not always cancer. Hematoma is just a collection of blood, like a bad bruise, but it usually signifies a mass of some kind.
Paralysis.
Paraplegia, quadriplegia, hemiplegia, which we mentioned earlier,
Simple enough. That one's pretty straightforward.
and conchiena, P-E-N-I-A,
Deficiency. Lack of.
my mnemonic. If you have no pennies, you have a deficiency of money.
That's brilliant. I'm stealing that one. Leukopenia, deficiency of white blood cells. Osteopenia, deficiency of bone density, just means you don't have enough of something important. Rounding out the bad news, we have general conditions. There's a whole bucket of them. Omatosis, omopathy, omatodia, solidism, diastasis.
These are your catch-all buckets.
Mm.
They basically just turn a noun into a condition.
Okay.
Lipidopathy usually means an abnormal condition. Tuberculosis, psychosis. Dermatosis, a skin condition. Gotopathy means disease. Neuropathy is a nerve disease. Cardiomyopathy is a heart muscle disease. Asthis, inocecism, and ethicist generally just means state of. Hypothyroidism, alcoholism, psoriasis. They're just grammatical tools.
Okay. We've diagnosed the patient. They have inflammation, discharge, pain, and maybe a narrowing. Now we call in the mechanics. Segment 4, the toolkit.
This is the action movie part. These are the suffixes for procedures, instruments, and fixing things.
The most critical distinction in this entire deep dive, I think, is the cut family. We have satomy, agractomy, and adductomy. If you mix these up, I mean, you could be in real trouble.
You might cut the wrong thing or cut it out when you were just supposed to create a window. Let's break them down carefully.
TOMY.
This means process of cutting into or incision. You are slicing it, but you are not removing it.
Like a craniotomy.
Exactly.
Yeah.
They cut into the skull to access the brain, but they put the bone flap back. They don't throw it away. A phlebotomy is cutting into a vein to draw blood.
Contrast that with apendectomy.
ECTOMY. This means cutting out, removal, excision.
The mnemonic here is EC sounds like X, which means exit.
Exactly. Appendectomy. You are taking the appendix out. It leaves the building. Mastectomy, tonsillectomy. It's gone for good.
And the third one, the weird one, stomy. STOMY.
This means opening.
How do we remember this?
Stoma is Greek for mouth. So when you create an ostomy, you are creating a new mouth or a semi-permanent hole.
Like a colostomy.
Right. They create an opening from the colon to the outside of the body, usually into a bag. It's not just a cut like a tummy, and it's not just removing like an anectomy. It's creating a new pathway. A tracheostomy is a hole in the throat to breathe through.
So, tomy, incision, exit removal, stomy, new mouth hole.
Perfect summary. That's the trifecta right there.
We also have S-section and S-incision. They seem related.
They are. S-section simply means to cut, like a C-section, cesarean section.
Oh.
Excision is the process of cutting. So an incision is cutting in, an excision is cutting out. Very literal.
Now let's put the knife down and pick up the camera. The look and record family. Let's start with essoscope versus esoscopy.
Easy one. Esoscope is the instrument, the tool itself. Microscope, telescope, stethoscope.
And esoscopy.
That is the process of using the instrument. Arthroscopy is the procedure of looking into a joint with an arthroscope. Colonoscopy is the procedure of, well, you know.
Unfortunately. Then we have esography and esogram. This always trips people up.
This is a classic process versus product distinction. It's the same logic. Esography is the process of recording. Electrocardiography is the act of hooking you up to the machine and running the test.
Doing of the thing.
Exactly. And esogram is the record itself. The paper or the image that gets produced. The electrocardiogram, or ECG, is the actual squiggly line on the paper.
So mammography is what you go do. The mammogram is the picture the doctor looks at.
You've got it. 100%.
To measure.
Thermometer. Sphygmomanometer.
Gesundheit.
That's the blood pressure cuff.
Yeah.
Sphygmo means pulse. Manometer means pressure measure.
Wow. And opsy.
To view. We usually see it in biopsy. Bio is life. Opsy is view. You are viewing live tissue under a microscope.
Now for some specific treatments. Synthesis?
Surgical puncture to remove fluid.
My mnemonic. Amniocentesis is the big one people have heard of. I just imagine sticking a straw into the center of a juice box to drain it.
That's a very visceral image, but it's accurate.
Wow.
Thoracentesis, sticking a needle in the chest to drain fluid from around the lungs.
Priestplasty.
Surgical repair.
A rhinoplasty. A nose job.
Right. Think plastic. Plastic is moldable.
Right.
Plasty is molding or repairing the shape of something.
Mhm.
Angioplasty, repairing a blood vessel, usually by inflating a tiny balloon inside it.
A therapy?
Treatment, this one's easy. Chemotherapy, chemical treatment. Physical therapy, psychotherapy.
And lysis. LYSIS.
Separation, breakdown, or destruction.
Mnemonic.
Lysol, it breaks down germs.
Nice. Or electrolysis, using electricity to destroy hair follicles.
Perfect. Or hemolysis, the destruction of red blood cells. Dialysis, separation of waste from the blood.
Okay, we are in the home stretch. We've covered directions, numbers, diseases, and surgeries. Now we need to look at the body itself and some of its basic functions. Segment 5. The body and physiology.
These are the stuff of life suffixes, the building blocks.
CYTE.
Cell.
Erythrocyte, red cell. Leukocyte, white cell. Melanocyte, the cell that makes melanin, the black pigment in skin.
Hemoglobin.
Protein. The big one is hemoglobin. It's the blood protein that carries oxygen to produce or generate.
Hydrogen.
Right. It literally means water producer. Carcinogen produces cancer. Allergen produces an allergic reaction. Pathogen produces disease or suffering.
Plasm.
Formation or structure. Cytoplasm, the group that makes up the cell formation. Neoplasm, new formation, which we said was a tumor.
Nourishment.
Or nourishment or development. A trophy is what you get for winning or developing your skills, but here it's about physical growth.
Yes, exactly. Think of hypertrophy. Excessive growth. If you lift weights, you want muscular hypertrophy. But if you stop and don't use the muscle...
You get atrophy.
Right. Intertrophy for nourishment. The muscles waste away. Secretion. We saw it in an endocrine, which secretes inside, and exocrine, which secretes outside.
Now let's talk about body actions. Dyspnea, P-N-E-A.
Breathing. The P is silent, just to annoy us.
Of course.
Apnea, no breathing. Dyspnea, triple breathing.
Hypopnea, fast breathing.
Okay, here's another tricky pair. Dysphagia, P-H-A-G-I-A.
To eat or swallow.
And deshatia, D-I-J-S-I-A.
To speak.
These two are so close. Phadia versus phasia. How do we keep them apart? Because they're both common in, like, stroke patients.
They are, and it's critical to get them right. Look at the middle letter. Phagia has a G. Gorge starts with G. Gut starts with G. And the esophagus is for eating.
Got it. G for gorge.
And phasia have an S. Speech starts with S, and it's related to the word phrase. Okay, that's it. That locks it in. Dysphagia, trouble swallowing. Dysphagia, trouble speaking. If you mix those up, you're treating the wrong end of the body.
Absolutely.
States of being. Diastasis.
To stand, place, stop, or control.
Homeostasis.
Staying the same, standing still, the body's natural balance. Also, hemostasis means stopping the blood or controlling bleeding, fall or slide, relapse, sliding back into illness, prolapse, an organ falling forward or out of place.
Partum.
Birth, postpartum, antepartum, easy.
Death.
After death.
The professional. Neurology and histologist.
Neurology is the study of biology, psychology, cardiology. Neurologist is the specialist in the study of biologist, cardiologist, neurologist, the person who does this study.
And finally, the grammar glue. We have a list of suffixes that the source text says pertain to. They basically just turn a noun into an adjective. Rapid fire. Let's do it. Pertaining to. Renal, pertaining to the kidney. Neural, pertaining to the nerve. It's an aerodary. Our source text has a funny note here. It says, add aerodary pertaining to for final exam.
Someone was studying. Pulmonary, pertaining to the lungs. Coronary, pertaining to the heart. Pertaining to gastric, pertaining to the stomach. Pelvic, pertaining to the pelvis. Pertaining to venous, pertaining to a vein. Cutaneous, pertaining to the skin.
And one more lurking in the source. Tension?
Ah, yes. That one means pressure. Hypertension is high pressure. Hypotension is low pressure.
Wow. Take a breath.
That was encyclopedic. That was a lot.
We did it. We actually covered every single term on the list. But more importantly, I feel like I can actually use this. This is a usable skill now.
You can. If you are listening to this, try to build a word right now.
Okay, let me try. I want to say inflammation of many nerves.
Okay. So many nerve, inflammation-itis.
Polyneuritis.
Exactly. Or what if I said hemigastrectomy?
Okay. Hemi is half. Gastro is stomach. Echosectomy is removal. The removal of half the stomach.
You're fluent. See?
It's not Klingon anymore. It's just Legos.
It is. And before we go, I think it's worth asking, why do we still use this? I mean, why does a doctor say rhinorrhea instead of runny nose? It feels pretentious sometimes.
It does. It feels like they are trying to confuse us or, justify the bill.
It can feel that way. But think about precision. Stomach ache could mean 20 different things. Is it the muscle? The lining? The acid? Is it bleeding? Is it actually your intestine?
Right. It's vague.
But gastritis tells you exactly what tissue is inflamed. The stomach lining. Gastroenteritis tells you it's the stomach and the intestines. Gastrectomy tells you exactly what they did. This dead language, Latin and Greek, is kept on life support because it allows for a universal, precise engineering language for the human body. There's no ambiguity.
So next time you get a doctor's bill, don't just stare at the total and cry.
Well, you can still cry at the total.
Okay, fair. But also read the line items, translate them.
You might even catch a mistake. Or at the very least, you'll know exactly what you paid for. You'll have that power.
Thanks for diving in with us. We'll see you next time.
Stay curious.